the early changes of Alzheimer's begin 20 to 30 years prior to the executive function failure. When our blood sugar elevates, it tends to change our brain's immune system from being friend to being foe. The empowering part of that statement is the shift is under your care. You can control that.
My next guest is Dr. David Perlmutter, a board-certified neurologist. I'm going to be talking to him about the idea that Alzheimer's may be a type 3 diabetes, a metabolic disease essentially. Dr. David Perlmutter, why don't you start by telling us about your qualification?
Well, Brandon, thank you first of all for having me. I am, as you mentioned, a board-certified neurologist. Neurology has always been my passion, but I'm also a fellow of the American College of Nutrition. I'm the only one with both of those designations. I'm a 6 times New York Times bestselling author. And my focus is really on neurodegenerative conditions in general. And you mentioned we were going to start off with Alzheimer's, and I think it's a very, very important topic that we should open up.
The first thing I'd like to ask you on that front, if someone is diagnosed with Alzheimer's disease, is it a foregone conclusion that they're going to be dead within 10 years, would you say?
Well, I think if we just look at what mainstream medicine has to offer these individuals, the answer is yes. Almost, will they be alive? Yeah, and what will that quality of life be like 10 years from now? It's hard to imagine what that's going to look like. But I will say, on the other hand, right now, as you and I have this conversation, there are some incredible advancements in the understanding of what is causing the brain to go bad in Alzheimer's disease. And why is that important? Because it's now giving us some incredibly important tools to really combat that problem. And I think, to be fair, my mission is not so much focused on treating patients who are down the slope of Alzheimer's decline, although that's what we do. It's also, and I think equally important, to focus on how to keep your brain healthy today and keep you from having to worry about what's my treatment going to be, rather make you the steward of your own brain's destiny.
If you come to a patient who has an Alzheimer's diagnosis, let's say they could go back 30, 40 years, what is the main things they should be doing at that point in their lives?
That's a fantastic question, because the reality is that the early changes of Alzheimer's, we'll call them the metabolic changes in the brain, begin 20 to 30 years prior to the memory failure, the executive function failure, what we call the clinical markers of the disease, where basically your brain isn't working right. So that's where we need to intervene. We need to intervene in people your age and make them recognize that lifestyle choices you are making right now are going to play out when you're my age. So, if you want to be cognitively intact, I'm 70, and have conversations like this, you better start doing the things at your age to rein in your metabolism, your blood sugar, your blood pressure, your insulin sensitivity, your body weight, your serum lipids, your blood fats, as it were. These things are critically important in terms of your metabolism, and Alzheimer's is fundamentally a manifestation of problems earlier in your life with your metabolism. The empowering part of that statement is you can control that.
What would you identify as the most compelling evidence that these metabolic factors are influencing Alzheimer's?
Well, for me, there's a lot of science out there that makes it very clear. The increased risk of developing Alzheimer's if you're type 2 diabetic is about 3.8-fold, for example. That means you're more than triple at risk of getting Alzheimer's if you're a type 2 diabetic. And these, the incidence of diabetes is skyrocketing. Here in America, we have 40 million type 2 diabetics, meaning 40 million people whose risk for Alzheimer's has increased threefold. And they don't have to be type 2 diabetics. We have about a third of our population pre-diabetic. That's worrisome, but even more worrisome is that 90% of those people don't know it. So they're on the continuum to become diabetic. They're on the continuum to increase their risk of Alzheimer's by about threefold. That's where we need to intervene. For me, if I'm thinking about all the literature, this is a little bit of an outsider for you. The most compelling thing that comes to my mind is an image, a picture. And what that picture shows, it's a special type of brain scan that looks at the brain's ability to use glucose, blood sugar, as a fuel, and shows significant issues with that early on, long before the clinical manifestations. So what I'm saying is the brain's ability to use fuel appropriately is compromised decades before we begin becoming forgetful. And that's all about our metabolism.
Are there broadly encompassing blood tests that people can have? Are there specific recommendations you would give for people to be able to identify what they specifically might be missing and what they need to cater their diet to?
For sure. And again, I can't overemphasize the idea of looking at your blood sugar dynamics, i.e., your blood sugar levels and your insulin levels and your A1C. I think they're very valuable. Beyond that, we need to get a good panel of vitamin D level, for example, and vitamin B12 level. I like something called homocysteine. It's not often done, but people should know something called homocysteine. It is a chemical, if you will, in the body that when it elevates is threatening to the lining of the blood vessel. In my case, my homocysteine was not in where it needed to be because of my genetics. And the good news is the fix was straightforward: methylated B vitamins. My homocysteine is now perfectly normal. Those are the keys. And beyond that, we could look at markers of inflammation. We could look at more sophisticated blood work that relates to the brain, p-tau217 as a marker of Alzheimer's risk, or we follow that in patients with Alzheimer's. There are multiple brain-specific blood tests that can be done. But I think the main thing is to look at our inflammatory markers, if you have a laboratory that can look at that, or general inflammatory markers like C-reactive protein. But I mean, in an ideal world, if I had a wish, I would say fasting insulin, because very few people do it. And a lot of people have told me after the fact, I went to the doctor and I asked her or him to do a fasting insulin. They refuse because I'm not diabetic. I don't want you to be diabetic. I want that to be, not in the future. And this is how we know where you are today. So, but we stay as they say, in the batter's box and keep trying to hit the ball.
Yeah, so someone in that situation should really go in and find another doctor, perhaps?
Well, perhaps that's an alternative. One alternative, though, is we can get these blood tests done now without a doctor. So there are various laboratories. Some of the most common mainstream laboratories in your town, you can walk in and have a fasting insulin level. Just check the box. And then the question is, what do you do with it? And who helps you interpret that? A lot of people are going to go to ChatGPT and say, my fasting insulin was 8 or 10. What does that mean? And hopefully they'll get some good information. But we want our fasting insulin levels to be pretty low, like between 2 and 5. If it's elevated, again, it's telling you you're already now on the continuum to become pre-diabetic, to become type 2 diabetic, and in my world, increase your risk for Alzheimer's by about 3-fold. That's why it matters a whole heck of a lot.
For women, is it a different consideration in terms of how high their insulin or how low their insulin should be?
No, it is not. I mean, there are other sex-specific issues that we could be talking about. I don't know if this is in the context of Alzheimer's disease, that's for sure. But women and men, really, fortunately, so it makes it easier for all of us, those parameters are generally not sex dependent.
The brain can create pain that is real in the presence of physical injury, obviously, to protect us. It can also create pain in the absence of physical injury when there's something going on in our lives that might be particularly stressful or emotional. They will develop chronic headache pain, back pain, stomach pain, or other disorders. But if you don't know that neuroscience and you haven't explored it, for the average person, it makes no sense. You're telling me I've got this severe pain in my back, and you're telling me it's coming from my brain? The pain reprocessing steps are to begin to notice the sensations that one has with less fear and less worry about them. Because the more fear of the pain, the more the danger signal creates more pain.
I'm aware of a veteran study that was recently done with looking at Qigong that showed positive results for relieving pain. With this kind of slow movement off Qigong and the focused mindfulness, do you think would that have played a role in these results?